Good afternoon, colleagues, and welcome to this webinar on psychological first aid in the workplace. The webinar forms part of the Focus on Wellbeing program that runs from today as its first day, and this is a third webinar today. Paula and Sarah have kindly done a webinar this morning for us. And this is the second one. It's a rerun of the one this morning. The program, the Focus on Wellbeing program, runs until the end of August, and new webinars will continuously be added to the program. So please look on the National Wellbeing Hub for new sessions and so on. PFA has been one of the strands of work, the concepts that have underpinned our response to the pandemic since the start, and other major incidents that we've had to deal with as well. We have with us Paula, Dr. Paula Easton, who's the head of the Rivers Centre in NHS Lothian in Edinburgh, and Sarah Phillips, who also works at the Rivers Centre, and I'm pleased to say is one of the team that oversees the content of the National Wellbeing Hub. I'm going to allow them to introduce themselves in the interest of time, but what I would say to you is, as the webinar progresses, please use the Q&A box, the chat box, for any questions or comments you may have. I'll be keeping an eye on that box, and we'll put the questions to Paula and Sarah at the end of the presentation. So without further ado, Paula, can I hand over to you, please? Thanks.
Thank you, Ray. I'll just share my screen, so just bear with me for a moment. Is that working? Can people see that?
Yes, we can.
That's fun.
Great.
Yep.
Okay, so thank you, Ray, and good afternoon, everybody, and welcome to this webinar on psychological first aid. Sarah and I are delighted to have been asked by Ray and by the National Wellbeing Hub to deliver this webinar this afternoon, and we'd just like to thank you for taking the time to join us. As Ray has just said, my name is Paula Easton. I'm a clinical psychologist working at the Rivers Centre in Edinburgh. For those of you who don't know the Rivers Centre is NHS Lothian's specialist trauma service, and I'm currently the head of service at the Rivers Centre. I've had the great privilege of working at the Rivers Centre for over 15 years, and throughout that time have worked with clients who've encountered a huge range of experiences of trauma and adversity in their lives. Although as an NHS service, our core business at the Rivers Centre is delivering an NHS service, we have also been commissioned over the years to work more specifically with members of the emergency services who've encountered trauma within their work role. And the Rivers Centre has been involved in developing guidance around psychological first aid, and working with colleagues in the Scottish Government have produced a guidance document, Preparing Scotland, which offers guidance on how to manage the psychosocial aftermath of emergencies. Over the past year, Sarah and I and colleagues in psychology established and delivered the Psychosocial Wellbeing Helpline, which was named Here For You for health and social care staff in Lothian in response to the pandemic. And this helpline was based on the principles of psychological first aid. Colleagues at the Rivers Centre also set up the Promise website, which you'll now know has been renamed the National Wellbeing Hub. And Sarah and I hope to share with you today something of what we see as the life story of psychological first aid. I've been involved in delivering several sessions over the past year on psychological first aid, and common issues that have come up in those sessions are helping people to feel more confident in knowing really what psychological first aid is, as well as what it isn't, and where it fits in the sort of wider context of staff wellbeing. Therefore, I hope that this webinar this afternoon addresses some of these issues. I'll pass over to Sarah just briefly to introduce herself as well.
Thanks, Paula. Hi, I'm Sarah Phillips. I'm a counselling psychologist working at the River Centre. I've been at the River Centre for 6 years, and my role has recently developed to include working on the National Wellbeing Hub.
Thank you, Sarah. So by the end of today, as an overview to what we hope you'll gain from today's webinar, we hope that first and foremost, you'll gain a better understanding of what psychological first aid is and what it isn't. We will walk you through the 7 key components of psychological first aid, and we will use some examples both from our work with the Here For You helpline and with a couple of case examples of how you might put psychological first aid into action. We hope that this will then give you the confidence to deliver psychological first aid where it's appropriate, and also to understand where it sits within that wider context of staff wellbeing. And finally, a focus on staff wellbeing includes all of us, so that includes you, and therefore we will highlight the importance of looking after yourself whilst you're looking after others. So let's start with what is psychological first aid. It's a term that you may well have come across in the past, but one that has been far more widely used, and perhaps therefore you've become a lot more familiar with it since the start of the pandemic in early 2020. Psychological first aid was originally developed as a response to major incidents or disasters. The PFA model is designed essentially to reduce the initial distress caused by traumatic events and to foster both short and long-term adaptive functioning and coping. It's intended to assist people to cope both in the acute phase of a major disaster and in the longer term, rather than necessarily preventing or treating any subsequent mental health problems. Psychological first aid does not assume that all survivors of a trauma will go on to develop mental health problems. Instead, it's based on an understanding that people may well experience psychological, behavioural, or spiritual reactions to an acute crisis, that some of these reactions may cause distress that will interfere with adaptive coping and subsequent recovery, and really that a compassionate, caring, psychological first aid approach may be of some benefit. PFA aims to provide practical care and support based on the needs of each individual. Therefore, it's not prescriptive. It's a set of guiding principles. These principles include essentially things such as instilling feelings of safety and calm, improving a sense of self and community efficacy. Crucially, it's about connectedness and about instilling hope. Essentially, it's about supporting people to feel safe right now, to feel connected to their loved ones and their colleagues, and reconnecting people to internal and external resources and strengths. It includes basic information gathering techniques to look at what are the immediate concerns and needs, and it implements a supportive and flexible approach to supporting people. This may be about providing information and resources around self-care. It may be about supporting people to use their tried and tested coping mechanisms or adapting their coping. And it can be used both in the acute phase of a crisis as well as over the course of recovery. At its core, psychological first aid is a set of principles based on addressing the psychosocial factors which we know impact on our ability to cope and to recover from trauma and adversity. It's designed to react and respond to the needs of each individual, but it focuses primarily on practicalities rather than emotional adaptation. It's a model of psychosocial care that aims to promote resilience and psychological well-being. It's about attempting to facilitate the normal process of recovery following trauma and offers support, practical assistance and information, as well as highlighting the importance of follow-up and appropriate intervention should that need arise. So there are a number of key components to effective psychological first aid, which, as I say, we will walk you through as we go through this webinar today. There's no particular order in which they should be followed. That order will depend on the individual and the circumstances, and they should be each modified to match the needs of that individual. It's well known that in the case of major disasters, the majority of affected individuals, of affected families and communities cope with great resilience, and that the majority of people do not require formal psychiatric or psychological intervention. However, of course, a rise in psychological morbidity is to be expected. What psychosocial support recognises is that our well-being comes from a combination of factors, and this model aims to enhance and restore these to help people to cope in the face of stress and distress. So these can be factors as simple as having our basic needs met, making sure that people have shelter, making sure that people have money, making sure that people have food. In the context of the pandemic, you know, it's about these basic needs being met, and we all know that's been helpful for people when they've been faced with this adversity. It's about the availability of good social support, and it's about instilling positive coping skills. This document you'll see on this slide, as I mentioned before, is a report that was commissioned by the Scottish Government and written by colleagues of ours in the River Centre. And it's in its guidance based on psychological first aid, targeted at the psychosocial sort of aftermath of any kind of major incident or disaster. And this document, Preparing Scotland, is available if people are interested and would like to follow that up. So before we go on to talk more about what psychological first aid is, it might be helpful at this point to also spend a moment on what is meant by debriefing and in what ways PFA differs from debriefing or psychological debriefing. The concepts of debriefing and psychological debriefing can potentially be confusing, and so I think here it's kind of timely just to have a moment to think about these alternatives. Some of you may be very familiar with the term medical debriefing or hot debriefing, which refer to gathering people involved in a difficult situation. So, for example, perhaps the death of a patient, immediately after that event has occurred. And the purpose of a hot or medical debriefing is to discuss the professional and practical needs of a team at that point. So, for example, what went well, what didn't go well, how best can the team be supported? A cold debriefing is a term that some of you may also have come across. This refers to a more in-depth discussion with staff involved in a difficult situation, which may be days or weeks after the event. The purpose of a cold debriefing is usually an opportunity for professional reflection and learning, again, rather than sharing emotional responses. Psychological debriefing, or a term that people might have heard, a critical incident stress debriefing. These are concepts that were developed in the 80s and 90s, primarily for use with emergency service personnel. So this model of psychological debriefing encouraged the processing of a single incident traumatic event through a series of stages in a one session debriefing. That debriefing session could last from 1 to 3 hours, and ideally it took place between 24 and 72 hours after the incident. The purpose and the intent behind psychological debriefing was to sort of try to reduce the impact, to reduce any further symptoms of people potentially developing a post-traumatic stress disorder. So psychological debriefing became very popular for a time as staff that attended these debriefing sessions tended to anecdotally report them as being helpful or useful, and that really fueled their practice. However, research then began to be done into actually the effectiveness of these sessions. And that began to challenge the position of psychological debriefing. And back in 2001, the Cochrane Review Group did a large-scale literature review of the effectiveness of psychological debriefing. And what that Cochrane Review Group found was that this type of psychological debriefing was not effective. And indeed, it could actually be harmful to some people. And the conclusion of that review was that this kind of psychological debriefing or single instance, critical instance stress debriefing should not be offered and should not be used. So on the back of that large literature review, in light of this emerging evidence against single session psychological debriefing, psychological first aid was proposed as an alternative. So what is PFA? PFA is an evidence-informed modular approach developed to help people in the immediate aftermath of a major incident. So that's how it was originally developed, was in the immediate aftermath of a major incident. It was designed to reduce the initial distress caused by traumatic events, and as I said before, to foster that short and long-term adaptive functioning and coping. So PFA isn't counselling. It's not about asking a person to analyse their situation. It's not about asking sort of pressuring people to talk. Instead, it's based on a set of principles that we know help people to recover and to cope from trauma and distressing situations. And this slide here illustrates the 7 key components to a psychological first aid approach. Caring for immediate needs, protecting from further threat and distress, offering comfort and consolation, offering support for practical everyday tasks, providing information on coping, facilitating connection with social supports, and offering education about normal responses. So really what the psychological first aider is doing is sort of making a brief assessment of the needs and concerns of the individual and seeing where these sort of 7 key components may be helpful and how they can facilitate these. Crucially, it's also about this not being a one-off sort of intervention or one-off conversation, but the PFA involves that opportunity for follow-up and where necessary, and if it's requested by people, to signpost people to appropriate mental health support or other evidence-based treatment. So this approach really has elements of sort of compassionate listening, it has elements of psychoeducation and of normalising the range of reactions that people may experience in situations of trauma or adversity. It can be applied more formally. So it may be for some people that it's about, scheduling a conversation, checking in with people more formally in terms of arranging a time to talk, or it may be applied in a much more informal context, just having a conversation with a colleague, checking on somebody to see how they're doing, making sure that basic needs are met whilst people are on shift. So ensuring that people are taking their breaks, that they're managing their meal times, that they're able to rehydrate and rest. It might be about holding in mind staff who may be more vulnerable to distress due to pre-existing difficulties with their own mental health, or an awareness that they're encountering increasing pressures at home or at work. It's about encouraging staff to use social support networks, whether that be at work or whether that be at home. Having a sense of common purpose and camaraderie at work has been shown very much to reduce the long-term impacts of any difficult situations. So we'll go on to illustrate these key components with some examples of how we've used that, both with staff calling in to the Here For You line over the course of the pandemic, but also, as I said, with Sarah bringing a couple of case studies to life and looking at how these 7 key components may be a sort of applied and used when we're looking after each other. So again, what is it not? What is psychological first aid? Is not counselling. It's not psychological debriefing, and I hope I've now made that sort of a distinction between what psychological debriefing is and what PFA is. It's not about asking a person to analyse their situation or pressuring a person to talk about their feelings. It's certainly not something that only professionals can do. And again, that's something that we hope to highlight, that this isn't something that only psychologists can do, only managers can do. This is something that anybody can do. And it's not something that everybody who's affected by an emergency is going to need. People should neither be encouraged nor discouraged from giving detailed accounts of their experience, but rather given the opportunity to talk if and when they choose to do so. COVID-19 has meant that we have all faced increased risk, stress and adversity over the past year. It's not a major, it is a major incident, but it's not a single event or one that has yet reached an end point. However, in the face of this increased risk and stress arising from the pandemic, PFA has been the model that's been adopted as the guiding principles to help support people and support staff over the past year. You'll no doubt all recognise these kind of headlines that have been on the front of the papers over the past year. And, you know, for COVID, for its part, it has actually acted as an accelerator of change. And it has certainly brought into the spotlight the need to support our staff. And it has, I would argue, accelerated the implementation of programmes aimed at staff wellbeing. In particular, there has been this growing awareness of the potential psychological impact of the pandemic, particularly on frontline workers, and a realisation and a recognition of the potential for the development of things like post-traumatic reactions, as well as other psychological morbidity in those working in the frontline. And in response to this, psychological first aid has guided the establishment of helplines and resources such as the ones I've detailed here. Regional and national psychological support helplines have been set up for health and social care staff. The National Wellbeing Hub, which you'll all be aware of as you've all registered for this webinar through the hub, was established, you know, just sort of March, April last year. And if you've had the chance to have a look at the hub, it really offers an array of information and resources to individuals and managers. In addition, you know, research groups have been set up to study and examine the psychological impact and needs of staff as a result of the pandemic. Some of these papers, again, are available on the hub if you're interested in looking at the research that's coming out of the pandemic. The majority of studies to date have come out of China, with sample populations taken from frontline staff working primarily in urban hospitals. So we don't yet have comparison data for psychological impact on primary care or the social care workforce. But, you know, the preliminary findings that we do have found that the COVID-19 pandemic has had psychological impact on frontline hospital staff. And a lot of this research, as I said, has been done with frontline workers, particularly nurses in the acute hospitals. And coming out of this research, the recommendation that nurses would benefit from psychological wellbeing initiatives. So this allows us now to move on to thinking a little bit about how psychological first aid has been applied over the past year, and how that might look going forward. So looking back and thinking about how at the start of the pandemic, what did PFA look like for health and social care staff? And you'll remember that back in March, April last year, the emphasis very much was on the provision of PPE. So, you know, in terms of psychological first aid, that caring for the immediate physical needs, protecting from further risk. And that's just as important for our psychological well-being as it is for our physical well-being. Staff were concerned about their own risk of infection, but also about the potential risk that that posed to their family. And going back to the research that I had just touched on, research published since has found that adequate provision of appropriate PPE is one of the key determinants of the subsequent psychological impact on staff. You'll remember that efforts were made to find alternative ways for frontline staff to help families communicate due to the enforced separation. Hospitals were using iPads and FaceTime to keep relatives in contact where that physical separation was impossible. Helping people to consider the practical needs, things like how would they manage childcare? How would they look after vulnerable relatives? How do people get food and feed themselves and their families? These were the kind of things that were of utmost importance to people at the time. And having good, accurate, reliable information on a wide variety of matters was essential. So again, even information on things like shielding, where to get testing, how should people self-isolate? You may remember the information was ever changing, sometimes on a daily basis, and having access to accurate information at times was actually very challenging. We all found ourselves in this unprecedented situation, having to adapt to completely new ways of working, new ways of schooling our children, new ways of shopping, exercising, socializing, and recognizing the impact that this might have on us. And the range of normal responses allowed a normalizing of emotional reactions to what was going on. As I mentioned, we set up the Here For You psychosocial support helpline for staff based in Lothian, health and social care staff based in Lothian. And the themes that were arising from those calls were along the lines of, again, this fear of contamination, fear of picking up the virus, or fear of spreading that to colleagues, to patients, to family members. People sometimes were calling with feeling unsupported by management, feeling completely exhausted and overloaded at work, at times feeling incompetent. And we were also getting calls with people feeling anxious about returning to work following periods of being off sick. We had calls coming through from all aspects of health and social care staff, on wards, domestic staff, porters, catering staff, GPs, as well as other community-based staff. So, for example, pharmacists or staff working in care homes. To manage the helpline, it was crucial that we had access to the accurate information that I was just talking about earlier, and where to point people in the direction of appropriate resources. Our colleagues at the Rivers Centre developed the National Wellbeing Hub website in just a short matter of weeks, which was not just an incredible achievement, but an essential resource for us so that we could direct people to the website as a one-stop shop for everything that they might need. So the majority of the calls we took a very similar format. We spent a lot of time normalizing staff's emotional reactions to extreme stress, reassuring them that these reactions were because they were human beings and that they were having normal human reactions. We helped them to acknowledge that they were often working in very different ways, different settings, and that this would inevitably bring extra demands and stresses. We focused a lot on the importance for each individual of looking after themselves. So that prioritizing of self-care, reminding them that the pandemic was going to be a marathon rather than a sprint, something that you've probably heard over and over again over the last year. But that without looking after themselves, without you guys looking after yourselves, that you're not going to be able to be there and to look after your patients, your family, your friends. Many of the staff that we talked to talked about the huge demands and pressures that they were facing and feeling guilty, therefore, about taking breaks. So we would gently challenge this and we would discuss giving themselves that permission to take breaks. that the break allows us to remember the basics, to stay nourished, to get a drink, to have a rest, and that it's okay to take some time out to rest and restore. One of the key things we know is that social connection and good, accessible social support is one of the most important protective factors for all of us in the face of trauma and adversity. Trauma can be a very isolating experience in the circumstances of major incidents, and in this case, in the circumstances of the pandemic, actually meant that social connection itself became a risk. So how did we stay connected to colleagues, friends, family? It was still crucially important to be able to do this. And often we needed to look at new ways and adapt our ways of having that social connection and using it in a helpful way. Exercise, yet another of the key coping strategies that we would speak to people about. And what we all recognised was that our coping strategies often needed to be rethought. We needed to adapt what we would normally do because we were being instructed to stay at home. But making sure that we got some exercise, whether that be outdoors or whether that was in our own homes, again, was something that we would talk to lots of people about. We were sort of reminding people about their helpful and healthy coping strategies. What had they used in the past? What would be normal for them that maybe had fallen by the wayside or was not so possible anymore? And how could they be creative and adapt and do things differently? We talked about sort of trying to minimize the use of unhelpful strategies, you know, things like drinking too much or using substances. Any of these strategies that actually on balance, you know, were not so helpful. We would talk to people about that too. You may remember that, I mean, there still is, it feels like a constant stream of information and news about the pandemic. But there was certainly, you know, last year, a near constant stream of exposure to information about COVID through the news and through the media. And people were often searching for information. They were seeking some sort of clarity, but that was always rapidly changing. And people often were talking to us about feeling overwhelmed and distressed by what they were reading and what they were seeing on the news. So we would talk to them about the possibility of switching off, or of limiting their exposure to news programs, limiting their use of the internet and taking a break from the news. I remember on nearly every call that I took discussing this idea of self-compassion. We were hearing people with high levels of self-criticism, levels of guilt, shame, people feeling that they were not doing enough, not coping, not doing it right, whatever right might be. And so encouraging self-compassion felt like an incredibly important part of this. And in the context of so much bad news, of so much uncertainty, unpredictability, in the light of increased demands and stresses, actually recognising, sharing and celebrating the good news, the bits that had gone well, no matter how big or small they were, again, felt even more important. And this final point of talk and reach out, this is something that Sarah and I will come back to again and again over the course of this webinar, but encouraging people to talk and to reach out to their social support networks wherever possible. Again, just emphasising the importance of that social support in terms of our coping in the face of trauma and adversity. I'm going to hand over now to Sarah, and she's just going to talk you through a couple of case studies, which again, hopefully will illustrate how psychological first aid can be used in action in your day-to-day roles.
Thanks, Paula. So case study 1.
Oh, sorry.
That's okay. So in case study 1, Sonia manages a small care home for 6 people with a learning disability. During the first wave of the pandemic, the care home managed well with a skeleton staff team who stayed at the home. Sonia was extremely busy caring for the residents, accessing PPE supplies and developing new policies, particularly around visitors and the use of PPE. Visitors weren't allowed and the PPE was limited. However, they managed not to have a case of COVID. During the second wave, COVID went through the home, resulting in the death of 2 of their residents. Sonia had struggled to get the medical support that her residents needed, and she had to inform the next of kin of the death of their family members. The deaths of the residents have hit Sonia and her team hard. The residents had been there approximately 10 years. As the manager, Sonia feels immense responsibility for the deaths and is worn out. She's been busy trying to ensure that her residents and staff are doing okay, but she's working long hours and is not looking after herself. Sonia is at risk of needing time off work due to stress and exhaustion. So thinking about PFA, how would you be approaching Sonia? You might be her manager, but you might also be one of the people that she manages. Checking in with her about how she is feeling, normalising those feelings, talking to her about how hard she has worked and validating that hard work and letting her know that she's had a positive impact on the needs of the residents and her staff team. Her dedication and commitment has helped people to get through this tough time, and just having that said to her would be incredibly powerful. Thinking a bit about caring for Sonia, so asking her what she needs to help her get through this. Maybe suggesting that she take some annual leave to recharge her batteries. I'm well aware in that first wave, a lot of staff felt that they couldn't take annual leave and that they needed to continue to work, and staff had to be reminded, actually use your annual leave, you need time to rest. Maybe Sonia actually needs to think a bit about having a chat with her GP and to consider whether she's well enough to be at work. Thinking a bit about how Sonia can be supported. Asking her if there's anything that you can do to ease her workload. And then thinking a bit about connecting Sonia with other people. Asking her who she is talking to when she gets home. Does she have somebody that she can offload to? We heard time and again on the helpline staff who felt they couldn't talk to their partners or family members. It was just too difficult, and that actually that maybe the people, their friends from work or the friends that they had trained with, they would be the people that they would normally talk to, but finding that time was really difficult and they didn't want to be online at the end of a difficult shift. So just helping Sonia to think a bit about how she can connect with people is important. And maybe that what she needs to be doing is booking a time with a friend to go for a walk. Providing information on coping is probably going to be important for Sonia. Asking her what does she do to keep herself well when work is okay, what is it that she does? Is it exercise? Is it reading a book? Is it gardening? Is it seeing friends? And reminding her that she still needs to be doing those things, and that those are particularly important to be doing when things are tough at work. Maybe she needs a bit more than that, so directing her to resources that might be useful. Again, going to the hub and having a look on the hub and suggesting specific apps like Daylight or Sleepio, or just reading some of the articles on the hub. So looking at case study 2, Paula, thank you. So case study 2, Ruth is a clinical support worker on a busy ward. She's relatively new to the job, but is fitting in well with the team and is enjoying the work. During her last shift, she was asked to check on a patient who was using the bathroom. Ruth found the patient deceased following a suspected cardiac arrest. Ruth called for support with the situation. As the incident occurred late in the shift, Ruth had a quick debrief with her charge nurse before she went home. Ruth was not back on shift for 4 days. During her time off, she had difficulty sleeping and worried about how she had handled the shift. Ruth was concerned that she had missed something earlier in the shift that may have contributed to the patient's death. When she returned to work, she found it difficult to concentrate, was slightly withdrawn, and did not discuss her concerns with other team members, as she worried about what they might think of her. So again, thinking about Ruth and PFA, how would you be approaching her? How many of you would have rung her or messaged her after the shift and then checked in with her again when she returned to work, asking her what she needs to help her to be at work? So providing comfort and education, so checking in with her about how she is feeling and normalising her feelings. She's new to this job, so helping her to understand that it's normal to feel shocked and saddened and upset by this. And again, helping her to understand that her sleep is likely to be disrupted to begin with. And that being a good carer is about being human. It is about having that human response. And reassure her, remind her that she's new to the job and nobody expects her to know everything. And as she's returned, she's clearly lacking confidence. So the support she needs might be you just telling her that she's doing okay, and that just helping her to remember the stuff that she does know. And then again, connecting. So asking her who she's talking to when she gets home. Does she have somebody that she can offload to or just spend time with? And if she's not, if she's unable to talk to people at home, or she doesn't have friends that do similar jobs, is there somebody on the team who can buddy up with her? We often assume that people are doing okay. We tend to put on a mask when we go to work, and we don't recognise when our colleagues are struggling. So just asking, finding out how she's doing is going to be the most important thing. And then providing information on coping. That might be you talking to her about difficult experiences you've had at work and how you coped, helping her to understand that it's not just her who's feeling this way. Or it might be about directing her to resources that might be useful. Again, having a look at what's on the Wellbeing Hub and directing her to specific resources. We picked case studies to illustrate that anyone can use PFA. It's not something that just managers or psychologists can be using. If you think about how you are with your colleagues, you'll probably realise that you're using some of the principles of PFA. Those chats, those conversations you have with your friends at work, that's you looking after the well-being of each other. We need to be mindful that it's not just about physical well-being, but emotional well-being, and that they impact massively on each other. And it's okay to be saying, I'm not okay today. I need a bit of help, instead of putting that mask up and carrying on as if it's all okay.
Thank you, Sarah. So hopefully Sarah's case studies and that little bit of overview of the way in which PFA was used when we were running the Here For You Wellbeing line illustrates for you the principles of psychological first aid in action and how these principles can be implemented both in the aftermath of a specific incident, as well as how they've been used in response to the pandemic. Despite the very real challenges of the past 15 months, the COVID-19 outbreak has shown many aspects of the health and care system at its very best. Health and care workers have responded with outstanding dedication and skill. Clinicians and managers have gone above and beyond to rapidly develop new ways of delivering services safely. Hospitals have joined forces to offer each other mutual support to ensure continued provision of essential services. And in some cases, areas you may be aware of, NHS, local government and other local services working together like they never have done before in order to coordinate responses and to support their communities. In short, the health and social care sector have shown incredible fortitude and resilience in the face of extreme stress and adversity. And perhaps the silver lining to the pandemic is an acknowledgement that organisations need to put the well-being of their staff centre stage, and that without both a physically and psychologically healthy workforce, organisations can't deliver the highest quality of care. I'm hopeful that this will no longer be an afterthought, but that staff wellbeing in the long term will be something that's now viewed by organisations as fundamental and core to its values. Large amounts of funding have already been earmarked for developments in staff support nationally. As an example, Scottish Government and Health Foundation funding has been committed by NHS Lothian to the continuation and further development of the Here For You service, establishing a psychology staffed staff support service to work alongside our occupational health colleagues. You'll also note in this diagram from NHS Education for Scotland the emphasis on proactive and preventative measures that organisations need to have in place in order to protect staff from psychological injury within a much wider wellbeing framework. So your wellbeing and that of your teams and your staff is essential to the delivery of high quality services. And this current interest in psychological first aid and the recognition of its value, which is reflected in the number of you attending the webinar this afternoon, and the one that we ran this morning is fantastic. But this needs to be embedded into a much broader system of primary, secondary and tertiary prevention, with mental health support at multiple levels, at peer, managerial and organisational levels. What we know is that there are a number of factors which serve to protect your psychological well-being and that keep you well at work. And these need to be acknowledged, they need to be understood, and they need to be put in place as much as any PFA system. On this slide, I'm going to run through the factors that we know are protective to your psychological well-being at work. And as I do so, I invite you just to reflect on these for yourself and for your team. Just to think about these protective factors and risk factors, which I'll move on to. So what do we know are protective? Well, your professional identity and your role as a helper. Being able to professionally distance yourself, so having a professional rather than a personal involvement. We know that feeling prepared and having good, accessible, available training. And that sense of competence, knowing what your job is and feeling able to do it effectively. Again, it's social support, being part of a supportive team with clear values and a meaningful work role. And feeling able to talk about what you've been through and having the opportunity to do so if you want to. And crucially, knowing yourself well enough to spot if things aren't okay and being willing to seek help. So I invite you just to reflect on those factors for yourself, see if you can relate to those and how you feel those are for you at the moment in your work roles and for that of your team. The absence of these protective factors can present a risk to our psychological well-being. And I think it's interesting again to look at this slide and reflect on this on your own circumstances and your own roles. And actually, as we go through this, it really highlights, the risk factors that the pandemic has brought. So events or situations when you can't detach, or when you identify with those people involved, and where there's an overlap with your personal life. When you perhaps feel isolated and unsupported. When you feel you can't talk about it for fear you might upset or cause distress to others. So that idea of toxic burden, and it was something that came up in the webinar that we did this morning, we ran this morning. You know, that often people don't feel that they can take home to their partners, to their families, to their loved ones, situations that they may have dealt with at work. And it's thinking about then what are those other social networks? What is in place in your workplace? What supervision do you have set up? How do you know, what management systems are in place? What support mechanisms are there at work if people are feeling that they can't take what's been going on at work home and back to their families? When normal coping isn't possible, or when your physical resilience is overwhelmed. We know that if you're in a position where you feel blamed or undermined, or when things go wrong and you feel the mistakes were made, that this can be a risk factor in terms of the impact on people's psychological well-being. Or when you personally or directly or your colleagues are in danger in some way. So it's interesting to look at that and read through that and think about that in the context of the pandemic, and we can see therefore why there may have been a real risk to our psychological well-being, given the circumstances that we've all been facing over the last 15 or 16 months. But I hope what this also illustrates is where the components of psychological first aid can serve to mitigate against these potential risk factors. We can also take this to an organisational level and think about the systemic factors that can play a role in terms of our psychological well-being. We know that where there's poor resourcing and low morale within staff, that these can offer real threats to our psychological well-being, or where there's poor management or a culture of bullying, or where there is a culture where help seeking is prevented or frowned upon or stigmatized in some way. So again, I invite you just to reflect on these factors and consider how your organisations may fare when considering these issues. Well-being is essentially a balance between protective factors and risk and vulnerability factors. So in order to establish a resilient workforce, organisations have to recognise that occupational and environmental factors need to be addressed in order to create a healthy, safe and supportive work environment. I hope that what we've been able to illustrate, and I appreciate in a fairly quick run through of PFA, is a better understanding of these 7 key components of PFA. That PFA is a set of guiding principles, that it's flexible, that it can be implemented from sort of the immediate aftermath of an incident over the course of recovery. It can be implemented in situations like the pandemic where there's ongoing threat and stress. And that these components, can be delivered by anybody. They can be delivered by peers, they can be delivered by friends, they can be delivered by managers. You don't need to be a psychologist, you don't need to be brought in from another organisation in order to implement these components. So just as a reminder, these 7 key components are around caring for immediate needs, protecting people from any further threat or distress, offering that space for comfort and consolation, and assessing and supporting the need for help with practical tasks. It may be about providing information on coping, about educating people about normal responses to stress and adversity. And again, crucially, about connecting people with their social supports, facilitating that connection and allowing people to make use of the support around them. If you found this session today helpful, My understanding is that it is being recorded, and therefore it will be available on the Hub for reference, or if you feel that this is something that may be helpful for other people to learn a little bit more about. This slide here is another webinar that myself and my colleague Jill Morton filmed towards the end of last year, and we were asked to do that by NES, that's the NHS Education for Scotland team. It's more specifically related to COVID, but again is a resource available to people if they want to have a little bit of you know, a reminder about psychological first aid and how that can be put into action. I mentioned at the beginning that when we're looking after others, we mustn't forget to look after ourselves. Just like on the plane, when we're instructed to put on our own oxygen mask before we begin to help others. We know that high levels of stress and anxiety in the health and social care workforce have been shown to decrease staff morale, increase absenteeism, lower levels of work satisfaction, and all of this inevitably impacts on the quality of care that we can deliver. So organisations have a duty of care to us, but we also as individuals have a duty of care to ourselves. And it's as important to look after ourselves, again, bringing in that idea of self-compassion, of acknowledging that we too may need support. We too need to think about our own self-care. What are our coping strategies? What helps us to cope in the face of additional stress and demands, as it is for us to understand that and how we can help other people. So this is just a quick sort of slide to help you to think about the 5 ways to well-being. This may be something that you're familiar with. It's been something that I know has you know, been disseminated quite a lot around recently, these 5 ways to well-being. But they're a nice little way, a little summary of remembering what's important. So connect. You know, we've gone on and on, Sarah and I, about the importance of social connection and social support. So, you know, give it time, invest in your relationships, grab a cuppa with a friend, with a colleague, pick up the phone, use your social support, and invest in those relationships around you. Be active. You know, again, we know that exercise and being active and, you know, being outdoors, all of these things are very good for our well-being. And again, I think they have been acknowledged and recognised even more in the past year. So be active, do what you can, and enjoy what it is that you do, whatever that is. Take notice. So be aware of what's around you. You know, it may be about actually pausing, taking in using your senses, taking in the sights and sounds and smells around you. People may be more familiar again with the concepts of mindfulness and mindful meditation, mindful breathing. Again, there's resources on the Hub that can sort of walk you through some of that, but take that time to pause and to notice. We're often very, very busy in our lives, always concerned with what we're doing now, what's happening next, what's happened in the past. Take that moment just to pause and to be present. Keep learning. So we know that being curious, trying something new, you know, it may be that we've had the opportunity in the last year as our normal activities and social activities have been reduced, that we've learned a new skill, or we've taken up something new, or we've done something we haven't usually done, but we've never done before. Being curious, trying something new is one another helpful factor in our well-being. As is giving, you know, whether that's your time, whether that's your words, whether that's your love, your kindness. So again, I just invite you to take a few minutes to reflect on that, reflect on these 5 ways to well-being in terms of what keeps you well. And if you can prioritize that self-care and really acknowledge and give yourself that permission for looking after yourself, then you are going to be more available and offer a better support and care to those around you. Finally, most of you, most of the time, will cope well with the stresses that you face. Okay? Make sure you know what it is that keeps you well. You know, what are your coping strategies? What do you use? Who are the supports around you? And if you find that you're not coping, then seek help. And that will allow you to recover as quickly as possible. Thank you for listening today, and for all the work that you have done and that you do in your work roles. We've hopefully given you a bit of an overview and an understanding of psychological first aid, and I know that we hopefully have a little bit of time now if there's any questions or comments that have come up in the Q&A. So I'll hand back to you now, Ray.
Thanks very much, Paula, and thanks, Sarah. And yes, there are a number of questions, many questions, in fact. If I could start with this one, which has been put, we've spoken about using PFA when dealing with work-related incidents. What about if someone brings personal trauma into the work? Is PFA just as relevant?
Shall I take that, Sarah? Do you want to take it? Yeah. Absolutely. I guess what the thing with PFA is it doesn't really have boundaries or situations in which it's not appropriate. You know, this is a psychosocial model which is about offering comfort, you know, promoting recovery and resilience, and it's as relevant to personal trauma as it is to work trauma. I guess the bit here is how much people feel that that's something that they can manage, you know, and whether they feel you know, that needs more than what a PFA approach can offer. But I don't think there's any boundaries to what PFA can be applied to. As it is about, as I say, those guiding principles of offering support and encouraging resilience and coping.
Thanks very much. There are a number of comments, or some comments, I should say, that where colleagues who are participating in this webinar have experienced that low morale, and particularly within managers who don't seem particularly interested in helping colleagues. I guess if we look at that, there may be many reasons for that. It might be that they're struggling themselves. So in that situation, what have you got any suggestions about overcoming that? When, you know, if I as a one of a team looking for support but can't get that support from my manager in terms of using the PFA approach. Sarah, do you want to take that? Or
yeah, do you mean in terms of that the managers are unsupportive of PFA?
Yes.
Okay.
Yeah, that's where I'm reading the question.
And I guess at that point I'd maybe be redirecting them, asking managers to go back and look at documents that have been published, the Preparing Scotland document, and again maybe suggesting that they visit the hub and have a look at some of the information on the hub about you know, managers supporting staff, and I guess those are quite difficult conversations to have if your manager's not being supportive of that, and I appreciate, Ray, that there may be a whole host of reasons for managers. You know, I'm just kind of thinking 15, 16 months down the line, managers themselves, I think, are pretty worn out at the moment.
Great, thanks. It's along the same lines that people are colleagues are highlighting some challenges with colleagues who are working at home, and particularly, for example, social care or social work, where they've not got the normal support systems in place and are being asked to take on, and there's the extra burden on the manager or the team colleague who may themselves be feeling more fragile and not be able to offer that support. And these are challenging situations that people working at home and at some distance it's hard to provide that individual support to them. Any comments on that and how that could be addressed?
Well, I wonder whether it's about saying to managers, actually, I need a regular time with you, and you may be working from home, but can we have a regular slot? Maybe it's at the end of the day or at the beginning of the day, or if doing something daily is too much, having it a couple of times a week, but having that, making it more of a formal check-in, and kind of saying, actually, I need this. I really need time with you as my manager.
Great, thanks. Because again, I go along the same lines, a number of questions along these lines about tired people supporting other tired people. Yeah. And the question is, how can we encourage people to give? As we know, compassion for others is good for our own health when people are tired and have reduced tolerance. So it's along that theme, isn't it, of dealing the whole team is tired. How do we support each other when we're all tired? Yeah,
and I guess that really highlights the importance of the self-care, doesn't it? I think that the question in itself highlights this, this issue that if we can't, if we're unable to sort of look after ourselves and prioritize that self-care, then it impacts on our ability to offer support and care to others, whether that's our colleagues or whether that's our patients or our clients. And so I think it comes back again to that importance of self-compassion and looking after ourselves, and perhaps looking at ways in which we take that break. If we go back to some of the case example that Sarah brought up, it may be that people actually do need a physical break. They need to take some leave, or they need to be having a conversation about how they manage, because what we don't want is people getting to a point where they're reaching a point of burnout and going off sick, for a longer term. So it's having these conversations, I think, sooner rather than later, if possible, in a way that prioritizes self-care and self-compassion.
Okay, let me turn to just a couple of questions on technique, if you like, in terms of implementing PFA. What are the common barriers to effectively implementing the PFA approach in ward settings or community settings or other settings? Are there any?
So I think on the ward, it's that having that time, if you're working on a busy ward, actually having that time to stop at the same time as a colleague to have a conversation, and there being a space where you can have what is quite a personal conversation. That's a potential barrier. And I'm thinking a bit about kind of more community-based settings. If you're in and out of your work environment, you may well not be seeing that many people on your team, so maybe not having a regular opportunity to touch base, at which point formalizing those opportunities might be necessary, or creating new routines for your team. Maybe having that, actually on a Wednesday morning we're going to stop and we're going to have a coffee together, and it is going to be a coffee. It's not going to be talking a bit about the business side of the team, but a bit about us having just a sit down and a well-being conversation.
You're on mute, Ray.
This is a final question. Apologies, and then this is a very practical one. Is there a normal time, a normal in inverted commas, to offering support to a colleague after an event, an incident, or should time, is there a normal time to allow to elapse before I offer somebody support?
So, well, do you want to take it, Sarah?
No, you take it, Paula.
With the PFA model, I would say there isn't a time lapse. If we go back to what the components of PFA are, they're about making sure people are safe. They're about caring for any immediate needs. They're about offering comfort and consolation. These are the kind of things that are going to that are going to be helpful in the acute aftermath of any kind of incident. I don't think there's any reason to have a time lag before you offer those things. Those are things that are about, you know, caring for those immediate needs. So, you know, even giving some people some information on what they may expect. You know, it may be that you're having a conversation with people about how it would be normal. You know, no matter what way they react, that's normal. You know that range of emotions being normal after any kind of incident. But it might be helpful for them to, you know, to have a conversation and some information about what may happen. You know, that they may notice they're not sleeping so well, or they may feel a bit anxious, or so it's an opportunity to educate and normalize, but also really to care for those immediate needs. And the thing with the PFA model is that can be changing, you know, so it's not about just doing that in a single time, you know, so it may be that it changes what you do the next time you speak with someone, and that the needs that they're raising, or what they need support with, may be quite different, you know, in the hours and after something, as opposed to a few days later or a few weeks later. But that's what the PF model is proposing, you know, is that there is that kind of dynamic change, and that you're reassessing and going back to people and asking, what do they need now? You know, what can you help with now? Certainly, you know, sort of 3-4 weeks, if it's a kind of a post-incident or a post-trauma that we're talking about here. Certainly 3-4 weeks later, and people are still experiencing sort of high levels of symptoms, or feel that they're struggling, that may be the point then when you're maybe looking for a bit of additional support, or you're directing them to maybe go and speak with their GP, or look at some other resources, because we would expect by sort of 3 or 4 weeks post a single incident that people's normal coping and normal responses would be beginning to sort of kick back in, and things would be you know, they would be beginning to feel a bit better. But no, certainly with PFA, I think there's no need for a time lag. It can, you know, the way it's, you know, the components are, the principles of it are about offering that immediate need, whatever it may be. You're still on mute, Ray.
I'm going to end with this question. How do you support those who've lost part of their social support network because they're not able to see their loved ones abroad? They feel disconnected. This is extremely distressing and difficult for some people. What would you advise? Sarah, do you want to do?
Yeah, I think it's really hard. I think it's really, really hard for people, and I think that's where technology has been wonderful. You know, doing FaceTime with family as often as you can, and messaging them, but also looking to see, are there any other networks that are closer that you could be tapping into? And it may be that if you are working with somebody who does have family abroad, and their network is more limited, maybe just kind of keeping an eye out for them, and making sure that, you know, thinking a bit about buddying up with them, and recognizing that they might need a bit more support than people who've got relatives that are kind of within visiting distance.
Yeah. Okay. Paula, Sarah, I'm going to wind it up there. It's 5:15, coming up to 5:15, and thank you very much for leading this webinar for us and answering the questions. Thank you, colleagues, for your participation and endurance, probably some of you after hours, and for engaging with us quite constructively. Some of you have asked, the session is being recorded. It will be together with the slides on the National Wellbeing Hub, and we'll let you know when it's up there. It will be subtitled before it's put up onto the hub for the benefit of colleagues who need the subtitles. So thank you once again. Please do look at other sessions on the Focus on Wellbeing programme. They're on the National Wellbeing Hub, and they've been circulated widely to, I hope, to your organisations. And it remains for me once again to say thank you to Sarah and Paula for doing these sessions for us and for sharing your experience and answering questions openly and honestly. Thanks very much. Bye bye, folks.